for joining us for our webinar titled, Could Your Child's Vision Be Holding Them Back from Learning? I'm Dr. Valerie Lamb, and I'm one of the optometrists here at Insight Vision Center Optometry, along with my partner, Dr. Tan Maya. We wanted to share with you guys today about different visual symptoms or different visual skills that could affect your child and their ability to learn while they're in school. A lot of times they talk about vision being called the hidden disability because you don't even realize that it could be something that could be affecting their performance. And so getting their vision checked is always a good thing to rule out to make sure that it's not holding your child back from succeeding in school. So let me just go over a quick overview of what we're going to talk about today. First, I want to talk about the concept of vision being more than just seeing 20/20. You may have gone to the eye doctor before or had your kids' eyes checked, and they say, great, they see 20/20. They have no vision problems, but that's not exactly true. The second thing I'm going to talk about is visual efficiency skills that affect learning. The third thing is visual perceptual skills that affect learning. And the last thing I'm going to share with you is about vision therapy and how vision therapy can help, especially in kids with vision-related learning problems. So first of all, how many of you wear glasses? So I'm sure you've all heard of nearsightedness or farsightedness, right? But pretty much why we need glasses or contacts or some type of corrective lenses is to get clear vision. And this is typically what you think of when you think of 20/20 vision, right? I can't see far away, so I need some glasses. And once I put my glasses on, I can see 20/20. So let me show you this example. So here's a young lady. She's sitting in her classroom. What visual skills do you think she needs for this task? I'll give you a few minutes to think about it. Right, so many of you are thinking, well, obviously she needs to be able to see the board. So of course she needs clarity of sight, right? But here are some other things that you may not have thought of. She needs a skill called accommodation, which is also known as eye focus. She needs to be able to look quickly from her paper to the board. And as she's doing that, her eye is adjusting its focus to keep each distance clear. She also needs visual memory. She needs to be able to remember what she sees and copy it down to her paper, right? So she can't look up and, a teacher writes a sentence on the board. If she doesn't have visual memory, she won't be able to remember it to write it down on her paper. And last thing is visual motor skills. Obviously, she needs to be able to write neatly and to be able to write within the lines, right? And obviously, she can't do that without her vision. We don't call it eye-hand coordination for nothing. All right, let's take another scenario. I'm going to give you a few minutes. I want you to think about what visual skills you would need for this task. Right, so if you said clarity of sight, obviously the little guy needs to be able to see the ball, needs to be able to see clearly in order to see the ball. Other visual skills he needs is peripheral awareness. He needs to be able to see where the other players are, to see if there's a player on first who's trying to get to second once he hits the ball, to see who's out in the outfield, to see even the catcher who's kind of behind him. And all these things come into peripheral awareness. He needs to have pursuit eye movements. He needs to be able to follow the ball as it's moving. And this pursuit eye movements means the ability to follow a moving target. And he needs saccadic eye movements, the ability to look back and forth quickly from one target to the next. So for example, from looking from first base to second base, first base to second base, that could be considered a saccadic eye movement. So both of these examples just show that vision is so much more than just seeing 20/20. Both of these examples, the little girl sitting in the classroom and the boy playing baseball, not only did they need to see clearly, but they needed all these other visual skills like peripheral awareness, depth perception, accommodation or focus, tracking skills, eye teaming, pursuit eye movements. All of these skills are necessary to be able to perform the activities in life that we need to do. So a way that you can think of vision is we like to break it into two categories of skills. There is a category called visual efficiency skills, and then there's another category called visual perceptual skills. One great way to understand our eye is to use the analogy of a camera. So obviously, we all have digital cameras now, or we got cameras on our phones. But back in, I guess, the old days, or I guess even just the pro photographers, they still use things like SLRs, right? And so when we look at a camera, light comes in, right? And when it comes in, it goes through a lens. And when we think of our eyeball, as light comes in, it goes through our system of lenses, which consists of the cornea and the lens in our eye. And then obviously that image is projected onto some film, and in the back of our eye, that film is really what we call the retina. So going back to our hierarchy here of understanding vision in two categories, visual efficiency and visual perceptual skills, you can think of visual efficiency skills kind of like the mechanical skills of the eye. Everything that makes this camera work. Right? So this is the ability to focus. This is the ability to move accurately. This is the ability to create depth perception. Eye teaming, which is the ability to use the two eyes together as a team. The ability to track, to have your eyes track accurately across a page when you read. Or peripheral awareness, to be able to see what's in your periphery, like when you're driving or when you're playing sports. So you can think of all of these skills like the mechanical skills that we need every day to function, but these kind of have to do with, the mechanics of the eyes, how the eyes move, how they focus, how they perform, and also seeing the eyes, in terms of, we have 6 muscles that control how the eye moves. So also kind of seeing it or thinking about it in that perspective. All right, so going back to our overview slide, we have just accomplished, and hopefully I have convinced you, that vision is more than just seeing 20/20. Like you saw in the past slides, you needed all those other visual skills in order to have optimal vision. And when we talk about optimal vision, this is pretty much vision that's going to get you to succeed in school, in sports, and in life. So now let's talk about visual efficiency skills that affect learning. Again, I talked to you, or I explained that visual efficiency skills were like the mechanical skills of the eye, right? So let's think about how those would affect learning. All right, so let's take a look at this young lady here. So she's reading. She's probably an early reader. She's very cute. She's wearing some nice nerdy glasses. But let's imagine, for example, that this is how she's seeing the words on a page. Now, obviously, this is very dizzying and probably gives you a little bit of a headache. But truth be told, that some kids actually see text like this. And the reason is because of this condition called convergence insufficiency. So remember, one of our visual efficiency skills was eye teaming, right? Having the eyes work together as a team. Well, this condition is an example where the eyes don't work together as a team very well. They don't point in the same direction. They're not working together. They're kind of fighting each other. And the result is words swimming or doubling on the page. Oftentimes, these type of patients get a lot of eye fatigue and a lot of discomfort. And obviously, it could be very disturbing to them, and they just don't like reading. Here's another one. So take a look at the text here on the side. That's like an example of a passage from a book. And no, it's not your eyes playing tricks on you. It really is out of focus. There are a lot of patients that sometimes read this way. And the reason is because their eyes can't bring their autofocus into clarity, right? And so inside of our muscle, inside of our eye, we have a muscle, and this muscle is responsible for bringing our eye into focus. And pretty much accommodative infacility is when that muscle can't accurately focus. And the result is words tending to blur in and out. It's difficult to concentrate, and it takes a long time to adjust when copying from the board. So remember our first example, we had that young lady sitting at a desk, and we were talking about what skills does she need. She's looking from her board to the paper, board to her paper. She has to do that, multiple times in a 20-minute, 30-minute lecture, right? So imagine how hard her eyes are working to focus, unfocus, focus, unfocus, focus, and just going back and forth between two different distances, right? If you were able to do that quickly, imagine one, how fatiguing it would be, but two, how far behind you would fall behind the rest of the class. It'd be very, very difficult to keep up. And the last thing I want to demonstrate is this thing called ocular motor dysfunction. And this is poor tracking skills, right? So these red arrows are showing you kind of the direction of where the eyes are going as this person is reading through this passage. And you'll notice things like skipping from lines to lines, regressions, where they're supposed to read from left to right, but then they do a double take and then they go backwards and they are going right to left and they're jumping all over the place. This is a perfect example of poor tracking skills, right? And this is definitely one of the probably most common visual symptoms that we see in these kids. So obviously their reading speed is going to be down, their reading level is going to be behind, and it's maybe not necessarily because they don't know what the words are, but the true problem is that they're losing their place often while they're reading because of their eye tracking skills. So just do a mental checklist here. Does your child, or maybe a child that you work with, suffer from any of these symptoms? Maybe loss of place when reading, a lazy, a crossed, or wandering eye, maybe complaints of blurry vision out of one or both eyes, words kind of swimming around on the page, or words coming in and out of focus uncontrollably. They're slow to copy from the board. They complain of headaches, rub their eyes, say their eyes are tired, or just a general avoidance of schoolwork altogether. If any of these symptoms seem to kind of hit home or sound a little bit familiar, or may resonate with your child or a child that you're working with, it's possible that it could be a visual efficiency skill, or that is not adequate, or that is not working properly, and that's causing them to be struggling in school. So going over our overview, right, we talked about vision being more than just seeing 20/20, all these visual skills that you need to be functioning well. And then we talked about when they're not functioning well, this is what happens, and this is how it can affect their ability to learn in the classroom and their ability to read. So next, we're going to talk about the visual perceptual skills that affect learning. So we talked about this analogy. I won't go through it again, but again, our eyes being like a camera, right? So the light comes in, it goes through our lenses, and we get an image on our film. But obviously, that film needs to be processed in a computer. And in our human body, our computer is our brain. So when we think of vision, we talked about the visual efficiency skills being like the mechanical skills of the eye. The visual perceptual skills are like our visual problem-solving skills. So things like being able to have visual memory, being able to remember something. Laterality, directionality. This is directional confusion, or I should say the ability to know the correct direction or orientation of something, whether that be directions like right and left, or whether that be the correct orientation of letters and being able to recognize when letters are reversed. These are things like visual discrimination. Can you tell the difference between two very similar objects? Or figure ground. Can you find your figure amongst a background of distraction? So let me just show you a few examples of visual perceptual skills. But here's one, like we talked about, laterality and directionality. So children that have difficulty with laterality and directionality skills will have a lot of confusion with handedness, not knowing which is the right hand and left hand and not having a concrete understanding of that, and as well as multiple and frequent letter reversals. Right? So also, I want to take a side note because this is a very, very common question that we get from a lot of parents. And the question is, if my child has letter reversals, does that mean that they are dyslexic? Now, I am not a dyslexia specialist, nor do I claim to be, nor do I claim that vision therapy cures dyslexia, which is a very common misconception. And I think, yes, very much an area that is not well described or well talked about. But this is the official definition of dyslexia from the International Dyslexia Association. And pretty much just wanting to sum it up, dyslexia is a specific learning disability that is neurobiological in origin. It is characterized by difficulties with accurate and or fluent word recognition and by poor spelling and decoding abilities. These difficulties typically result from a deficit in the phonological component of language. That being said, if I could sum that up in a real quick statement, is dyslexia really is a language disorder. And I've talked to many teachers and educational therapists and just trying to, understand their perspective of dyslexia and also, kind of understanding the school's perspective and really, dyslexia is a very, I should say, is a very kind of a hot topic or touchy subject, but really what it comes down to is a language difficulty that is preventing a child from being able to read. Okay, so the biggest thing as far as our perspective from vision therapy is in vision therapy we work a lot with letter reversals, and knowing the correct orientation of letters. But this is the myth that I want to dispel, is letter reversals are not a diagnostic sign of dyslexia. So a child could have letter reversals and not be dyslexic. A child cannot have letter reversals and be dyslexic. And a child can have letter reversals and be dyslexic. So it's not a one-for-one thing. It's two separate issues. We consider it part of a difficulty in a visual perceptual skill, but not diagnostic of dyslexia. Okay, so just wanted to clear that up for you. All right, and here's another example of having a weak visual discrimination skills. So there's a word here at the top, and pretty much you ask a patient, hey, can you find, which of these words in the bottom are spelled exactly the same? So obviously there's a lot of very similar words, but you have to know kind of the problem-solving skills of how to rule out, which words are similar but not exactly the same. And so a person with poor visual discrimination skills would look at waving and look at half of these words at the bottom and think, they're all the same, and not being able to be accurate or careful enough to be able to distinguish what makes one word different from the other. And here is an example of weak visual motor skills. So we have gross visual motor skills, such as this girl standing on a balance beam trying to hit a ball, right? So it's eye-hand coordination, but like gross, meaning kind of like large movements. And fine visual motor skills, such as handwriting, and in vision therapy, we're not training for handwriting. I know that occupational therapists do a fantastic job of that. But in the sense, do you need your eyes to guide your hand in order to make an accurate stroke or write within the lines or know how to space things properly? A lot of that is motor skills in conjunction with visual perceptual skills. So here's another checklist for you. Go ahead and take a mental note. Does your child or the child that you're working with suffer from any of these symptoms? Things like excessive letter reversals, poor memory skills, messy and poorly spaced handwriting, frequent errors and overlooking small details. So again, just like we showed with that last example with the words, they look at one word and they automatically call it something else, because they're just glossing over it too quick. Poor eye-hand coordination. They have really messy handwriting, poor spacing. And here's a huge one. Homework that should only take 20 minutes takes hours. Right? So any of these symptoms are common things that we see in children that have visual perceptual skills. So going back to our overview, we're making good headway here. We already talked about the visual skills being more than just seeing clearly, but all the other visual skills that you need to succeed. We talked about the visual efficiency skills, the mechanical skills that affect learning. And now we just talked about visual perceptual skills that affect learning. If we're having excessive letter reversals, if we have poor memory, if we have poor discrimination and we're missing fine details, making lots of errors, you can just imagine the implications that all of that would have on being able to succeed in school. So the last thing I just want to tell you about is this treatment called vision therapy and how vision therapy can help. So first of all, what is vision therapy? Vision therapy is a custom program of exercises designed to strengthen the eyes and brain to treat many vision problems and learning issues. So I'm just going to show you some examples of what we do in vision therapy and how vision therapy can help to improve a lot of these visual skills that we were talking about. So here's an example of me working with a patient, and what we're doing is we are using polarized pictures to improve our depth perception. And this would be one of those visual efficiency skills, one of those mechanical skills. We need the eyes being able to work together in order to see great and accurate depth perception. Here's another one. We're doing an exercise here to improve eye teaming. We're strengthening the eyes, having this little boy focus on certain targets. We're making him do, sequences or jumps from target to target to target, making sure it's nice and clear, making sure that one eye is not turning off, making sure that the eyes are teaming well together and working equally. So that's another common activity, and this activity is called the Brock string. This is probably one of the most classic vision therapy activities. It's been around for ages. Here's some fun pictures. This is how vision therapy helps tracking skills and eye-hand coordination. So in this one picture where we're on the balance beam, we are working on one thing that you can't see in the picture is there's actually a letter chart. So we're reading letters, walking on a balance beam, keeping our balance, alternating hands and feet, all these things that this little girl has to keep in mind while she's tracking and reading letters. We do exercises like this to help patients keep their place when they read. And then in the other picture, she has a headset on. We actually have a virtual reality computer gaming system. It has fantastic, engaging games with great graphics. But obviously, the more important thing is that it's helping with eye-hand coordination, with depth perception, with accuracy, with timing, all these visual skills that we need to be succeeding in things like sporting activities. Here's an example of what we do in vision therapy to help improve memory and visual perceptual skills. So we'll do games, memory games. We'll teach strategies in order to help improve, and what we, give our patients just some more tangible strategies on how to problem solve these type of challenges, right? And also working on spacing, also working on lining things up, copying patterns, being able to understand visual images like pictures and diagrams and puzzles and things like that. And then last example is just here, understanding problem-solving skills such as, shapes. So obviously these are some younger kids, so our activities are not as difficult, but we would be doing discrimination, discriminating different shapes, different colors, spacing of different colors. The little boy with the ball is doing an eye-hand coordination. So he's doing he has to hit the ball with his stick while reading the letters on the ball. So incorporating a very difficult visual task with also a motor task. So these are just a few examples of vision therapy, just bringing you into our therapy room and allowing you to see what we do. But pretty much our general, or I should say our main goal is that we know that there are so many visual skills that we need to succeed in life, right? And again, these are the visual efficiency skills, right? Like the mechanical skills, the teaming, the tracking, the movement of the eyes, but also the perceptual skills, right? The ability of the brain to comprehend and to be able to digest and understand and problem solve the information that we take in through our eyes every day, right? And if we have trouble with any of those skills, right, what can we do about it? I mean, do you just make the child suffer with it and say, well, too bad, they have poor eyes or weak eyes, or they have poor memory? Like, no, right? We should do whatever we can to try to strengthen these skills, to try to intervene, to try to give these students the tools that they need to be able to succeed. A lot of, patients and parents ask me, like, when do we do vision therapy? And I say, pretty much, look, vision therapy is working on the foundational skills, the building blocks that you need to be able to learn higher order things like math and, science, and to be able to do all the academic work. You need these foundational skills strong first. So that's why we're so passionate about vision therapy, and that's what we focus on in vision therapy, is really building up and strengthening these foundational skills so the patients can take the skills that they learn there and then apply them to what they're working on in school. So I hope that presentation was just a short preview of our perspective of vision and how we see vision affect the students in the classroom. Again, we call these vision-related learning issues, right? Or sorry, learning-related vision issues. I guess both would work. But pretty much, what are the visual skills that are affecting a child's ability to learn, pay attention, and succeed in school? And if there are deficits, what can we do to help these skills improve? Right? And so we are very, very passionate about vision. We believe vision is not just seeing clearly, but that there's so many other skills that need to be, on par and top notch in order for your child to be succeeding and performing to their fullest, right? And this is why in our vision evaluations, we're so passionate about checking for just so many other skills, about going, below one level below the surface of what you would typically do in a normal eye exam, saying, okay, a normal eye exam might just check for clarity, but hey, no, we're going one level deeper. And this is why that we believe it's so important to check for all those other visual skills, is because it truly does affect the child's performance. So if any of these symptoms, especially those two checklists that we went over, seem to resonate with you or maybe with your child, please give us a call. We'd be happy to talk with you over the phone to kind of get to know your child a little bit more and to see if a vision therapy evaluation might be appropriate for them, and to see if vision therapy might be able to help. It might be the missing link that you've been looking for, and to really kind of get them over this hurdle and to get them on the road to success. So thank you for listening. I appreciate you tuning in to our webinar. Here's our email addresses, Dr. Lamb at Insight Vision OC or Dr. Mai at Insight Vision OC. send us an email or give us a call. We'd be happy to chat with you. And again, you're always welcome to visit our website, just not the email address, but just insightvisionoc.com. That's our email, that's our website address. Come onto our website to read more about vision therapy and to see if it's right for your child. Thank you so much. We hope you have a wonderful day and I look forward to seeing you soon. Take care.